Odontogenic sinusitis, or OMS, is a condition where a sinus infection originates from dental disease, particularly affecting the upper teeth due to their proximity to the maxillary sinus. This connection between dental roots and the sinus plays a key role in the development of OMS. In these CT images, we see the close anatomical relationship between the upper molars and the maxillary sinus floor. The roots of the second molar, as shown here, are just 1.97 millimeters away from the sinus floor. These molars, especially the first and second, are the most predisposed to causing sinus infections because of their close proximity. By contrast, the first premolar is situated much farther from the sinus floor at around 7.05 millimeters. Interestingly, despite these measurements, it is the first molar that is most frequently associated with odontogenic sinusitis, accounting for 22.5% of cases and studies, followed by the third molar and the second molar. Premolars and canines, as seen in these images, contribute to a much smaller percentage of OMS cases, with the premolars at just 6% and canines as low as 0.7%. One of the reasons for this is the thin layer of bone separating the maxillary sinus from these tooth roots. The bone is thinner in the molar region, increasing the likelihood of sinus involvement if dental disease progresses. However, this relationship is different on the buccal or lateral side of the maxilla, where the molars are farther from the bone surface than the premolars. The second molar, for instance, has a distance of around 4.45 millimeters from the buccal surface, while the first premolar is much closer at just 1.63 millimeters. This anatomical variation means that molar infections are more likely to extend into the sinus rather than into the surrounding soft tissue. In contrast, infections from premolars or canines may manifest as abscesses in the soft tissue overlying the maxilla, such as in the canine fossa. While the anatomical closeness of the roots to the sinus floor would suggest a high risk of sinusitis, the incidence of maxillary sinusitis due to dental disease remains relatively low. This highlights how effective the dense cortical bone of the sinus floor is at acting as a barrier, preventing the spread of infection. Overall, understanding these anatomical relationships is crucial for both diagnosis and treatment planning, particularly in cases where dental disease could compromise the maxillary sinus.